to our BFS clinic, the Breakfast Show Clinic. And today we are looking at neonatal jaundice. What is it and what do you need to know? How common is this condition and who is impacted by it? My guests are seated. Shulamite Aseye Tonye is a special education advocate, and sitting next to her is a pediatric specialist at Kolebu Teaching Hospital, Dr. Harry Akwa, and Mrs. Rachel Adum, who is a mom. Hello, good morning. Welcome to the show. Let's start with the doctor. Please explain to us in language that Cornelius can understand. What is neonatal jaundice?
So, neonatal jaundice, in simple terms, is basically yellowing of the eyes and the skin, basically that, and that yellow color that we see is from what we call bilirubin. I won't go further.
Okay.
It's just what do you call it? It's just a breakdown. What you get, a pigment from the breakdown of red blood cells, the blood cells in your body. The liver handles this bit and then converts it to a form that ideally should be harmless to the body. But unfortunately, in neonates, several factors could lead to this bilirubin being too much for the body to deal with.
Okay.
So you have it, you have it being accumulated in the skin as well as in the eye. So that is what we call neonatal jaundice. And of course, when we say neonate, it's actually the first 28 days of anyone's life.
Okay. So that's when the jaundice manifests, in the first 28 days.
Yeah, basically jaundice within that period
is
known as neonatal jaundice.
All right. You have mothers being advised to put their children in sunlight when the baby comes out quite early. Is it connected to neonatal jaundice?
Yes, there is a connection there, but it's one of the many myths that if I have the opportunity, I'd like to educate.
You have the opportunity.
Great, thank you very much. So there are several myths around neonatal jaundice. Some people advocate that once you have a child with jaundice, just put a few drops of breast milk in the eye and it's going to clear. I'm pretty sure Aseye is nodding to it. I'm pretty sure she knows all about those. And then there are others that also believe that neonatal jaundice is caused by some of the foods you eat while you're pregnant. And the truth is there is no real association between what you eat during pregnancy. I think someone mentioned that in earlier segments. There is no real connection between what you eat during pregnancy and the outcome of it. Others also believe that once the child has jaundice, it means that the mother has done something wrong. It's not entirely the case. Others also believe that, as you said, put the child in sunlight and then the child should be fine. But then it's not proven to help anyone. In fact, they have come out worse off when they have tried that. The other myth out there is that I just lost my trail of thoughts. The other myth out there has to do with sorry, when I remember, I'll just throw it in.
Yeah.
All right.
Yeah. So there are quite a number of myths associated with neonatal jaundice. What are some of the risk factors for developing neonatal jaundice?
Yes, great. So one major risk factor is prematurity. For preterms, because they were born during their time, it's their liver is not able to handle the load of bilirubin that is thrown to it. So it is very easy for them to develop jaundice. The other thing, still with the preterms, is the fact that the red blood cells, their red blood cells have a generally shorter lifespan compared to the older or the term baby, the more rounded baby. So it tends to break down faster than the term baby, and as a result, you have a lot more accumulation of this bilirubin that we've mentioned previously. Now, the other risk factor is infections. Particularly, there are some maternal infections that translate to the baby while the baby is in the womb.
Like?
And we call them the torches in general. Should I mention them? I don't think so. Generally, the torches, toxoplasmosis and others. These are associated with neonatal jaundice.
Right.
And then we also have infection to the baby.
Okay.
The baby itself.
Yeah.
Yes, exactly. Now, this is also associated with jaundice. We also have what we call ABO incompatibility. Forgive me
Blood?
for... Yes, basically mother's blood group not being compatible with the baby's blood group.
All right.
More often than not, the most implicated here is the mothers who are O, whose babies are not O.
Okay.
And then we also have resource incompatibility. It also has to do with the blood. Whenever someone goes to do a blood test, they say that the blood group, they say that, oh, you are O positive or O negative. Myself, I'm O negative.
Okay. I'm O positive.
You are O positive.
Yes, sir.
Ah, great. So myself, I'm O negative. What the positive up there means is that you have the resource factor. And if it is negative, it means you don't have it.
Okay.
Now, whenever a mother who is negative takes a father who is positive, and the baby that results is positive, then there is a real risk that the baby would have the jaundice. There are other factors. Key amongst these other factors is also poor feeding in the baby.
Okay.
So I think that people have asked that will breastfeeding aid the cause of jaundice? Probably, yes.
Okay. Before I bring in Aseye and Rachel, just quickly, how common is neonatal jaundice, and how do you diagnose it?
Yes, I must say neonatal jaundice is very common, very common. Early this week, a friend of mine sent me a text. She wanted to know that is it her, or she was wondering why she kept seeing a lot of these neonatal jaundice cases.
It's a colleague, right?
Yeah, she is a nurse. So she wanted to know whether it's just her end or it's everywhere. And I told her she shouldn't stress. It's everywhere. So it's very common, I must say. Picking it up is pretty easy. Sometimes the mothers even see it before. In fact, most times the mothers see it before we do. There are diagnostic tests for it, but then it's basically what you see. So it is pretty easy. You look into the eyes, at the white of the eyes, and then also under the skin. If I have the, if time permits, I'll demonstrate. No, I think I need to demonstrate that. So ideally, every mother has to, while bathing your baby, you have to inspect. And well, I shouldn't be telling them because they actually know this. I love it how the mothers go about it whenever they are taking.
But some may not know. Some of the modern.
Oh yes.
So what are they looking for in the inspection?
So what you are looking at, you should be paying attention to the white of their eyes, because more often than not, that is the first part the jaundice can be noticed. The white of the eyes. Then the skin. Start from the forehead to the bridge of the nose. What you have to do is to depress. We call it blanching. So just apply gentle pressure over the nose, and then for like 2 seconds, and then release it. Now when you do that, what it does is that it parts the skin a little so that whatever hue is there can be picked up. If this baby is jaundiced, you know, some of the babies early on, they will not be opening their eyes, and it's difficult parting their lids. But then if you could do this little thing, if you pay attention, you'll notice that there is a little yellow hue underneath the skin. And that is that is the big thing that hits you in the face that this baby may have jaundice.
Okay. All right. Let's bring in.
And sorry,
Go ahead.
the last thing is that this must be done at least twice in a day, and then also in sunlight,
So you can actually see.
so that you can actually see,
Okay,
not
sure.
in these lights.
All right. Great stuff. Let me come to Rachel before I go to Asay. Rachel, so tell us your experience with neonatal jaundice.
Yeah, thank you very much. I think I gave birth on the 1st of April. So he had a bulge at the back and a spinal bifida, because I'm a nurse, so I need a spinal bifida. So I think on the first day we were transferred from the University of Cape Coast Hospital to the teaching hospital, Central Region. So from there, they managed him for 2 days. So on the third day, we were transferred to Kolebu Teaching Hospital. We came, yes, within the 4 days, then we realized that he has jaundice. So we were at the hospital, and it wasn't easy, almost 3 weeks, that we were treating him, giving him antibiotics, running series of tests, different labs all over. And it's still, so it wasn't easy at all. And at the end of the day, we have to do the transfusion for him.
You did a blood transfusion.
Blood
How old was
transfusion.
he?
He was just about 2 months, I think 2 months. Yes, within the 2 months, because the first 1 month we were managing the 3 weeks. So with the 1 month, it's only 1 month, then we have to do it. So we were cancelled. And we said yes, we will do it. We are trusting God, and we witnessed it. I was with the doctors in there for the whole day. I think one doctor spent about two days with him, and it was just, it wasn't easy. First time mother. Yeah. So looking at the father, we were all witnessing and praying, but by God's grace, because the series of tests there, about 3 labs every day.
Wow.
Yeah, we didn't call a book outside. We want to know the real results. Doctors were not, even sometimes they don't understand. So you have to go outside and run another test. And it's the same thing all over. So by the grace.
And then after the transfusion, you went home.
Yeah.
What are some of the big challenges that you've had to face as a mother with a child who had neonatal jaundice?
Yeah, so the first thing that I learned, or I tried my best to do, is even to do the exclusive breastfeeding first 6 months. So even at the hospital, we're doing I was expressing the mom, even when I'm going to have a rest, then we give it to him. So that one was so constant, and it really helped. It really helped. So it encouraged us that wow, there is a result and it's good. So when we were discharged, it wasn't easy. I was with him, the whole family. We were just with him, giving him the best we have to do for him. Even though the challenges, going to work and other things, but we managed, and by God's grace, he survived. He survived.
We'll speak to the man himself pretty soon.
Yeah.
But before I get to say a quick one, Dr. Aqua, so does the jaundice stay? I mean, are you able to cure it, or does it stay with you for life?
No, it can be. Jaundice can actually be cured. It can be treated. I need to put it across that there are 2 main forms of it. We have one where that is caused by what we call accumulation of direct bilirubin. When we say direct, what we are saying is that the liver has been able to do what it has to do, but it has been able to render it harmless, but unfortunately it hasn't been able to come out. And there is a type that is caused by a certain group, that is caused by accumulation of indirect bilirubin. When we say indirect, it means that the liver has not been able to convert it to the harmless form we hope we would have, and that is what accumulates. The treatment options are varied. For the direct one, we need to know the cause, and quite a number of causes include surgical causes that need prompt operation. The most common surgical cause that we all fear is what we call biliary atresia. The outflow of that whatever comes out is not able to leave the biliary tree, and then it becomes a problem for us. If this accumulates, it destroys the liver and ultimately the child. And then The indirect one is also what we more often than not fear within the first 2 weeks or so of life, because that is what actually crosses there is something we call the blood-brain barrier, and then affects the brain. Now, when that gets to the brain, because this brain is developing, it hasn't gotten to the point where it's resistant to all these shocks. It can actually lead to a number of complications. So it doesn't stick with you for life, but then the after effects. Yes. But that said, I need to also put this across, that while the mother is looking out for the jaundice actively, she should also be monitoring the stools of this baby. She should be looking at inspecting the diapers on a regular, monitoring the stool for the color. If it is anything close to white, pale, that's what we call it. If it's anything close to white, the mother should act as fast as she can. But that said, whatever it is, so long as there is jaundice, she should act.
Okay. Let's bring in Asay now. So, Asay, you are a special education advocate. What does that mean, and how is it connected to neonatal jaundice?
Okay. So, when we come to special education, it's divided into several parts, like learning disabilities, autism, cerebral palsy, and stuff. So, with the cerebral palsy, I realized most of the cerebral palsy mothers talk about jaundice, that most of their children's condition were caused by jaundice. So I saw the need of us advocating and talking about it. So mostly what happens is most of these mothers are first-time mothers. So when it happens, they don't really know what to do, and it really results into cerebral palsy. And such conditions are very expensive to treat here in our country. So I think mothers can attend pregnancy classes. Mothers have to learn much on the internet. There are lots of information you can have, especially first-time mothers, so that they know what to do. Because of the doctor-patient ratio, sometimes mothers in maybe remote areas don't really get the needed attention they have to. But if they have a first-hand information, they can help, so that such cases will be treated as emergency.
What are the kind of challenges that you face in your work as a special education advocate? What are things people tell you? What do you have to stress on all the time?
Okay, one is most of the mothers have the financial support for mothers, yes, and the stigma. The stigma is one big thing, because I remember some keep their children inside and lock them up because of what others will say around. Some even go to the extent of confessing they killed their child. Yes, just because of the stress and the stigma of what people do. So it's very stressful. Sometimes people call me at 12 in the night about their children, because it's really emotional draining, because you are pregnant and you have I want my child to be this, I want my child to be this, and it comes out this way. It's not easy if you don't have the support, and most of the times the men leave, so it makes it very difficult for the mothers. Yes.
You identify with what she's saying?
Yeah.
What was it like? Where were you getting your support from? Where were you getting your support from?
Our support, my family. Yeah, the greatest support. Right? The extended family, my husband, everybody. They were all supportive. So I just thank God. I was fortunate. My husband and we were fortunate on the first day, right from Kolebu, even from there, we were just all over, helping us and even encouraging us, trusting that everything will be well.
Shout out to Peter.
Yes.
Yeah. He's the man.
He's the man. So he has been with us. Day one. Yeah. The family, the church, and I was just fortunate. I thank God for that. Awesome. And Cornelius is always grateful.
Fantastic.
Very,
I'm going to speak to your son Cornelius in a show, but I think I want to wrap up with Dr. Aqua. So treatment options. How do you? And I understand that neonatal jaundice is on a spectrum.
Yes, the effects of neonatal jaundice, basically. So the effects range from mild difficulties to profound learning disability. some patients are completely bedridden, others are wheelchair bound. There are few that can actually walk and then go about their daily activities as you would expect them, but their IQ, if you're able to measure it, you would realize that it's lower than the what we would pass for normal. Yeah. So the effects of neonatal jaundice are broad, and then there is no single effect. I'll just put it that way.
Just round on the table before I go and talk to the children. What is the key thing you want people to take from this conversation, Dr. Apple?
Yes, I want people to understand that neonatal jaundice is not completely preventable, but then it should be spotted early. And the effects can be prevented if picked early and treated.
All right.
This year, for this month, slogan is Spot the Yellow. And we are pushing mothers that be proactive in spotting the yellow. Yes, sometimes we say that mothers bug us a lot. My baby keeps stretching and all that. We don't need the stretchy bit. Of course, when you report, we'll help you allay your fears. But then what we need now is for you to spot the yellow.
Awesome. I say in 30 seconds, what should we know?
Okay, first time mothers should can take pregnancy classes, and they should read wide about what to expect when they have babies and all that, so that some of the things can be prevented.
Okay, Sarah, what should mothers have to get from you? What do you want to tell people?
Thank you. Yeah, they have to take care of the children. They have to be brave. When the condition has happened, that's what it says, your special child, our pride. Have pride in the child. Then let's move on. Don't stay where you are, that it is over or that is the end.
Okay.
So we come in to even bring them together, encourage them, take the children to school, empower women. Okay. Then we give them some little support to take care of themselves.
All right. Don't leave me. I'm leaving you, but don't leave. I'm going over to the other side of it. You go speak with Cornelius and his friends and Peter as well. So as GTV breaks, where am I sitting? Left or right? Right next to Cornelius? Yeah, I think I'll sit here. Cornelius, good morning.
Good morning.
How are you?
I'm fine.
My name is Uncle Calf. Yes. How are you?
I'm fine.
How old are you now?
I'm 9 years old.
9 years old. Okay. And this is Daddy?
Yes.
Mr. Adam, how are you doing?
I'm fine.
And then our friend, what's her name?
Mariam.
What's her name?
Your name?
My name is Martha.
Martha and
Mariama.
I hope you're all fine. Yeah. So how is it as a 9-year-old? What kind of things do you like to do?
I like to sing. I like to play the keyboard.
Oh, you should have told me I brought my keyboard, man. But can you sing a song for me?
Yes.
What song were you going to sing for me?
We give you glory, Lord.
Sing.
We give you glory, Lord, as we honor you. We give you glory, Lord, as we honor you. You are wonderful. You are worthy, oh Lord. You are wonderful. You are worthy, oh Lord. Ancient of days, as old as you are, as old as you are, you remain the same. Ancient of days, as old as you are, as old as you are, you remain the same.
I like it.
Thank you.
I like your voice. What do you want to be when you finish school?
I like to be a musician and a footballer as well.
Nice. Who's your favorite footballer?
My favorite footballer is Kylian Mbappe and Messi.
Hey, who is number one? Who is number two?
Messi is number one.
Messi's number one?
Yes.
Mbappe is number two?
Yes.
All right. Okay. Well, I wish you the very best.
Thank you.
Mr. Adum,
Yes, sir.
we're proud of you.
Thank you.
Yes, keep giving mommy support and Cornelius and everybody else.
You did that.
And God always did. The songs that he sang is a good one.
Yeah,
you are wonderful. And thank you so much.
Thanks.
All right, so that's our conversation here on neonatal jaundice. I have a chance to leave the adults to come and hang with the kids and one adult here. Remember, all that we spoke about on the show. If you've forgotten it, just go to our Facebook page, GTV Ghana. Follow us. You can watch this whole conversation all over again. You can hear Cornelius singing all over again right there on Facebook. My name is Kafri Dale. Hope you've enjoyed a lot of the conversation and learned a lot in the BFS clinic. We're coming back with sports at 7 o'clock. I don't know whether Kylian or Messi will be in the sports, but if you listen, you'll find out. All right? We're doing sports after. Okay? Take care. Take care of yourself. Yeah. Oh, I like that. Again. Yeah, it'd be so. It'd be so. Me and Cornelius hanging out here on the yellow couch. We're back with sports. Don't go anywhere. I'm going to listen to more music. You won't hear. All right. Thank you. Yeah, that was nice.